AT, take it away.
Yeah, well, thanks, JC. Not much more to say here. We're going to jump right in, but JC mentioned each entrepreneur will sort of talk for 5 minutes, share what they're working on, and as you have questions, put them in the chat. We'll probably have time to ask a few of those questions live, and then the rest, the entrepreneur can follow up with them in the chat. So without further ado, Christian Ross from Happy Talks, go ahead and take it away.
All right. Good morning, everyone. My name is Christian Ross, and I am the founder. Don't know what just happened. Hold on 1 second, guys. We literally just did this. See, there we go. Okay. So I'm the founder and chief happiness officer of Happy Talks, and we are on a mission to end loneliness. We offer caring pipeline phone support for aging adults. So loneliness is a health crisis. And right now, the 85 and older population is projected to more than double to 14.4 million in 2040. That's just a short, almost 20 years away. So families are busy, caregivers are stressed, and of course, loneliness is costly. It costs Medicare $6.7 billion annually. And that is where we come in. I'm going to show you a quick demo of what we are doing. We are calling seniors, and we're talking to them, and we are reporting back to families or their assisted living centers. So in this demo, I'm showing you exactly what we are showing our assisted living communities when they log in. So this is how we connect. You're just seeing the dashboard quickly, but there's an overview where they can look, they can book a talk, so they can select a time. They can view upcoming talks. They can see past talks and go into notes. They can see all the resident members that they have. They can add a member and, of course, acknowledge privacy, that they have that on file. And going back to the overview, they can look at everything just in a screenshot, and they can log in and see, okay, let's take a look at Nancy. Nancy, conversation points.
It looks like you're not sharing the screen that popped up. I believe you only shared one screen, so we can't see that last little bit.
I'm so glad you said that.
Yeah, we want to see this product.
Wow. All right. Stop sharing. And of course, I'm at the airport, so that is the bathroom that I'm next to. Now, can you see now by chance? Nope, you cannot. Resume share. Let's see, resume share, if that helps. Can you see?
Not quite.
That is very odd. It says it's paused. I keep hitting resume share. So sorry, guys. We literally just did this. Let me stop share. Oh.
Maybe you can share your whole screen and we'll just deal with your, startup screen. How's that?
Right. How's this? Can we see?
We can see. Yes, we can see your dashboard. Yep.
Okay. Unfortunately, though, you're not, when I click the link, you're not seeing. Are you seeing this now?
Yes. There we go.
Okay. All right. I have 1 minute. So you can book a talk. They can click. They can see upcoming talks, past talks. They can see all the members that are in their assisted living community. They can add a member, of course, acknowledging privacy, like I was sharing. And then we have, going back to the overview, they can take a look. Let's talk about Nancy. You can see her conversation points. Don't discuss holidays. She likes the Ellen Show. And you can also see the notes from the most recent conversation, as well as we call our conversationalist links. They can go in and they can see exactly who they talk to. She talks to John. John's been a coach for 10 years and a little bit about him. So our goal is that they can see the notes, they can understand who that person has been talking to. All of our links are background checked, have wellness assessments on file. And our goal is that that we have an engagement network for older adults and that we are impacting health outcomes and enhancing family and healthcare provider care. So that's what we do at Happy Talks with our conversations. And we love that our members are just saying that they can see the impact of our effect on the seniors that we're conversing with. Thank you so much. You can reach us at happytalks.co, soon to be .com in 4 days.
Awesome. Thank you, Christian. If folks have questions, put them in the chat. I got a couple questions just to start. So as you're seeing people use this, Christian, how often are they wanting to connect and talk with people? Like, do they want to talk every 10 minutes, or is this like a once a week conversation, or how often are they trying to talk?
So our membership is 8 15-minute calls a month for $99. And we actually work customized plans out for assisted living centers because we started B2C. That is the model that if someone signs up, that we are able to provide. And we do have one person that is every day. They're our beta call, they're 93 years old, and we're seeing how we're going to price that, the timing, and that those conversations actually helped us to reconfigure what we were doing to create 15-minute calls versus 30-minute calls, which we were originally offering.
Got it. And then for the folks that are available for the calls, to do that, are they all scheduled, and are they scheduled weeks in advance, days in advance, minutes in advance? Like how available is somebody if I say, hey, I want to talk to somebody right now?
They are scheduled days in advance, but they can be on demand. Like that's our goal, is to be on demand, and then also work towards having using AI to configure profiles to just match people as well. That's on our roadmap.
Got it. All right, a couple questions I see in the chat here. Is it only phone calls or texting as well?
It is only phone calls. We do follow up with the loved ones via text, and they can log in and have a similar interface for the family to see notes.
Got it. And then from Catherine, what are helpful intros for Happy Talks? How can the audience help you?
Oh my gosh. Good morning, Catherine. Helpful intros right now. I actually talked to someone at the Department of Community Health, and so they told me to call my local congressman to help weave through Medicare. So that's my goal right now, because we know that we can ride the tailwinds of just the fact that they are trying to align with value-based care now and not just service-based. So that's our goal. So any Medicare introductions, Medicaid introductions will be very helpful.
And is your vision on the coaches, like what's the ideal profile? And is there any thought of peer-to-peer, just connecting other folks in different assisted living or senior care to chat with each other?
That is on our roadmap, is that it will be peer-to-peer, and we will take a lot of the labor out of it. So we'll be extracting those profiles. We'll create, extract, and then match them up. And that as we are in centers now, that we can, when they have more than 5 or 10 communities, we can match, like, Deborah from Arizona with Matt from Kansas, because they both like these same 5 things.
Very cool. I like that. JC sounds like a little bit of the JC app. So,
Oh yeah.
Last question here from Hal. Are the coaches licensed therapists or closer to home health caregivers?
So we don't have anyone licensed. They're all just great humans that love to connect with people, which is great. So we don't delve in the therapy realm at all. And actually, when that said coach, it was really like that person coaches the rest of our links to help them with conversations and to help them understand how to transition conversations.
Got it. Well, Christian, thank you so much for presenting here. And if there's other questions folks have, feel free to put them in the chat and Christian can respond there. But
thank you so much. I'll throw my LinkedIn.
I love what you're doing.
Thank you.
All right, next we'll have up Mohammed. Mohammed, if you want to pop on the screen here, and feel free to take it away.
Sure. Thanks again, HealthIT, for inviting us. And let me see if I can share the screen. Super excited to be here to just have this conversation. Hopefully you all are seeing my screen. So as a way of introduction, my name is Mo, and I'm the founder of Healthcare. And so what do we do at Healthcare? We're connecting women of color to culturally sensitive providers. These are providers that are that go through a culturally competent training that's powered by ourselves and as well as Medscape. Well, the overarching issue that we're addressing is the fact that millions of women, approximately 7 million women living in maternity care desert with little to no access to care. So these are places that don't have OB/GYN physicians or they are really medical deserts. And so what we do is make sure that this women that are going through pregnancy get the right type of providers that care and listen to their needs, and ensure that we do our best to remove the bias that is plaguing the healthcare system that leads to a lot of the disparities in maternity mortality. I came to realize this problem after my own sister that passed during childbirth due to pregnancy hemorrhage, and my aunt died of a similar condition in Columbus, Ohio, pre-eclampsia. So what is our solution? Our solution is it's a comprehensive way of treating a woman. So one is telehealth, ensuring that they connect via video and message. We've got 2 mobile apps, one for patient and one for physician. And we also make sure that the moms have a support group that we refer to as Health Tribe. So mothers in this space are able to create different support groups for themselves. So a mom that may have experienced a pregnancy loss, they can create a pregnancy loss support group. They will share materials amongst each other. And if there are more personal things that they can share amongst each other, they post in our Q&A board, and our physicians go in there and answer those questions. We have more than physicians. We have primary care doctors. We have about 250 specialists, right? So primary care doctors, mental health clinicians, OBs, midwife, doulas, just to name a few. But in this video here that you see Matthew, one of our very first patients that we had a chance to serve. She was experiencing infertility, lives in Columbus, Ohio, had an OB/GYN physician that was being very dismissal of Matthew's need. She found us online, booked an appointment with one of our clinicians, Dr. Alawudi, who focuses on patients with infertility and other conditions. And the 2 of them spoke for 30 to 40 minutes, and he told her treatment plan for in her infertility, also prescribed prenatal vitamins, which we then sent to Matthew's home because we have an on-demand pharmacy that we integrate. We sent that prenatal vitamins to Matthew's home, and then 2 months after, she texted the physician that she's pregnant. Then 9 months after her child, John, was born alive and well. So part of the video you see as well, Matthew sharing her testimonial, how that app has improved her life. And then you see the physician side. And we also have AI machine learning that we integrate to the platform as well. So let me know if you all can hear this volume. Our entire mission is to modernize healthcare for women of color. Usually they don't have a voice, or have tried everything else, and we are their last resort, and we step in to help. Our patients get connected to culturally competent doctors via video and in-app message. Doctors are trained in to say that patient's voice is important. Listen to it very keenly. That will inform you to what kind of diagnosis to prescribe for that patient.
Me and my husband were trying to have another child. We tried everything. I'm from a culture where once you're married, it's expected that you're gonna start having children. In the culture, it's kind of sometimes embarrassing to even talk to other people about it. So the app was a way that you can do things in your home without anybody really knowing. The majority of the population that access that service are people of color, people that may be experiencing homelessness, or that may be experiencing a lot of comorbidities based on the fact that they are in that area and they're people of color and they don't have access to certain services.
That's why we exist, to ensure that mothers and their child can have successful birthing experience and change narrative for women of color. Google Play Academy has taught us to be able to reach more patients, not just locally, but internationally more effectively. So be able to reach patients from their lens, from their language. Google Play Store listening will scale that experience. Purposefully kept this video a lot shorter so that we can have some discussion. There is more, of course, to the demo of the tech itself in terms of product demo. But we've served about 50 healthcare providers that are using the platform, 10,000 patient consults to date. And we've gotten some venture money, non-dilutive capital. Google is one of our partners. And now we're just trying to make sure that this gets in the hands of more hospitals and as well as employers. So if there's any thoughts around Medicaid and as well as self-insured employers that are interested to talk to, like especially VP of HR and HR leaders, happy to chat with those. And yeah, and we're in the middle of a fundraise. 40% of that round is closed. At least, I mean, pardon me, 40% of that round is committed. And we're just in the process of just going through and finding a lead. And yeah, so let me pause. I know IT is probably going to have a lot of questions for me.
You know you well. Well, cool. Couple of questions coming in the chat, and I've got a couple as well. And thanks for sharing. So first question in the chat: what's the revenue model pricing?
Yeah, so it's a subscription based for providers, and it's $25 per provider per month. So subscription for providers, and then there's a health assessment for the patient side. So it's free for patients to download, but particularly the health assessment. This is where we're using AI machine learning to gather data around the patient risk factors. So among that, a patient may have diabetes, their risk factor, the nutritional guidance, that part of the tech, it's a subscription fee as well.
Got it. And so you're saying the providers pay to be on it. It's free to the patients. And then once an encounter happens, is that billed as a normal telehealth encounter?
Correct. The patient would then pay for that telehealth encounter. They will pay that on a cash basis if they don't have insurance, and we do collect that cash basis. We process that and ensure that on the back end the physician gets their payment directly as well, seamlessly. And then now, if a patient who wants to pay with insurance, we're in the process of also integrating that component so that we can actually process billing for those for our providers on the provider app.
Got it. And then, as you were saying earlier, so Medicaid is not involved yet, but you're looking to have
correct. Yeah, exactly. So like companies like Centene, Humana Medicaid are those that we're in conversation with to actually credentialize our providers with them. So we will credentialize us for 50 healthcare providers so that they can be able to serve patients from those institutions like Centene and Humana Medicaid, Health Horizon. But then providers can then be able to serve other insurance plans, right? So we're in the process of that credentializing our providers to serve other insurance, to take insurance as well as we're going to take insurance with as well as cash.
Got it. And then tell us a little bit more about your go-to-market strategy of how will people even find out about this? Is it going to be driven through the payers, through consumer marketing, through the providers, all the above?
Yeah, so it's been interesting. Our humble journey, now let me stop sharing here. So our humble journey itself, we started with healthcare providers and we sell into them directly. We launched in a several clinic in DC, then made our way down in 2020 down to Atlanta. But we've been selling directly to healthcare providers. Now we're also, because of scalability, it's to payers, right? Payers will pay us on a PMP basis, where we'll serve their members and make sure that their members are taken care of through access to culturally competent providers, and then allowing their members to go through from thinking about prenatal visits to postpartum as well. So that's the go to market. Really, from the payer point of view, they'll bring in more patients for us to serve, and then from the provider point of view, like FQHCs, they will bring in more physicians into the door. So that's the double-sided marketplace that we have.
Got it. And then last question here. Catherine's always great question. What intros are helpful? How can the audience help you here?
Startups are hard, but they're fun. So any introductions to those individuals that are particularly, I would say, for the case of like employers, self-insured employers, intros that will be helpful are for people that are HR leaders, right? VP of Human Resource, Total Rewards leaders will be super helpful to have conversation with. In the case of payers, usually the solutions director. So they just send them some titles. So any introductions to those, and FQHCs, oftentimes it's their CEO, right? Or their COO from those FQHCs, federally qualified health centers. So any intros to those will be super helpful.
Got it. Well, Mohammed, thanks so much for sharing what you're working on. Great mission. I love what you're doing.
Thank you, Iti.
All right. Well, last but not least, Cassie and Zia and team, you want to hop on?
Yeah, I think Cassie is going to share slides for us, but nice to meet everyone. I'm Zia and I'm CEO of StrideLink. I have my two co-founders, Cassie and Neil, on the call as well.
Nice to meet everyone.
Hello.
And we're looking forward to sharing what we've been working on. And thank you for the invite. So what StrideLink does is we remotely monitor gait health. And that's something that probably doesn't make sense to a lot of people. So if we go to the next slide, I have a couple headlines to kind of like introduce this concept of what gait is and why we monitor it. So gait is essentially how we walk. It's the more formal term because it kind of encompasses all of the biomechanics that exist within walking. And so there have been studies, over the past couple years that kind of point to gait and gait analysis being an indicator for predicting health outcomes for different populations, and also for something that you can use to really monitor how a patient is progressing throughout treatment. So a pretty good example of this is how gait analysis is done for someone who's post-stroke. So typically someone post-stroke will go to an outpatient physical therapy clinic. And what that physical therapist will do is they will have that patient walk and just watch how they walk completely visually. We've talked to probably, 30, 40 different physical therapists, and then into the hundreds when we're including physical therapists, biomechanic experts, researchers we've talked to, and then most importantly, the orthopedic foot and ankle surgeons. And really what we've seen is gait is so important, and it's something that they keep track of every single time that patient comes into the clinic. They're doing this analysis, but this analysis is conducted entirely by the naked eye, which means it ends up being pretty objective, or not very objective. It ends up being pretty subjective because it's really difficult to collect objective data. And then also this is happening just in the clinic. It's essentially like having a patient come into clinic who's experiencing heart palpitations, listening to their heart for a couple minutes, and then saying, we didn't really see anything, or that's really all the data that we have, and then sending them out. You're missing all of this data that's taking place outside of the clinic. So that's kind of the main issue that this lack of technology in this market has caused. So kind of like I was pointing to, everyone's familiar with the general health and wellness devices, the Fitbits, the Apple Watches, if you're really into Step Loop. All of that really just is giving a consumer a general idea of activity, health, and wellness. They're pretty good with cardiovascular system and monitoring that, but really there's nothing that focuses specifically on gait. And that's really the gap that we're fitting, which is kind of between what's happening in really high-end research labs that require a huge staff, specialized engineers to kind of set up really low accessibility, and then the consumer wearable side, where we want to be right in the middle of that to kind of meet the need that these outpatient physical therapy clinics and foot and ankle orthopedics face. So what our system is it's a pair of wearable sensors. Then we have two front-end systems, the first being a smartphone application. So the sensors essentially transmit data to the smartphone application. A patient can walk out of the clinic with these sensors on. These sensors work just like a Fitbit, where you wear them and they're continuously tracking gait and reporting it to a physician-facing dashboard after going through our entire cloud backend where we're doing analytics, we're processing the data, all of that to kind of display a comprehensive chart to a provider that's going to allow them to track how these different gait metrics, which really relate to the patient's gait symmetry, which I'll explain on the next slide, but allow them to track that over time throughout the course of treatment to kind of show how effective the treatment was, or any changes that might need to take place to make the treatment more effective. So if we go to the next slide, this is really the crux of the technology. And this is why I love presenting something like this to a crowd of people that are all really familiar with the medical field, because we can kind of go into this amount of detail. What we really see this technology becoming is something that is as crucial to, how these different providers do gait analysis as ECGs are to the cardiology field. And it's kind of a good comparison to make, because gait, how we walk, is a known cycle. It's repeatable. You have these different elements of it that you can measure in a very cyclical and symmetric way. In the same way that we already do that for cardiology and ECGs. So what that means is when we track gait in this way, we're actually able to point out different abnormalities. And if there's an abnormality, it's going to show up as an asymmetry or a disruption to the cycle, which is a really important way to objectively measure gait and recovery. So just a little background on where we're at right now and our research partners. We're actively working with Children's Hospital Colorado and their Center for Gait and Movement Analysis. They are honestly world renowned. They have one of the best gait analysis centers, clinical gait analysis centers in the US, and they have some really brilliant people over there helping us with an STTR grant, specifically working with children with cerebral palsy, and then also looking at ACL repair. And then we are working with Houston Methodist and Texas A&M and their orthopedic biomechanics laboratory to do a 30+ subject validation study, which should take place towards the start of next year. And we somewhat recently closed out our pre-seed funding raise, which was around $580K to go to sensor development, application development, and really get the technology off the ground and get listed with the FDA. And this is our team. That's pretty much it. I want to leave a lot of time for questions.
Awesome. Well, thank you so much, team, for what you're doing here. So my wife's a physical therapist, so is a big believer in all the stuff that obviously they do post incident for gait, but she's she's walking around watching somebody run and saying they're going to have knee problems in the future. There's tons of proactive stuff.
They're good. Yeah.
That can be done.
No.
Well, cool. So tell me a little bit more about the use cases, because obviously there's lots of use cases, reactive post-surgery, proactive, like we're talking about, getting into the rhythm. Athletics uses stuff like this a lot for optimum or peak performance. There's aging care, for somebody who's about to have a fall. What use cases are popping up that you're focusing on?
Yeah, the beautiful thing is every single person we talk to has another use case, including clinicians, which is good, but it's also distracting. So one of the challenging things for my team was really picking what market we want to target first. And that ended up being specifically foot and ankle orthopedic. So that this is something that an orthopedic surgeon, specifically someone doing foot and ankle, an example would be a ankle arthroplasty, where you're doing a replacement or a fusion for the ankle joint. And the reason we've picked that market is for a couple reasons. One, it's massive. It's a huge market. There are literally millions of Americans every single year that kind of fit into that category. And two, it's really, really easy to track an obvious asymmetry and how it's going to improve over time. Because if you think about it, you're doing one thing to one side of the body, specifically the ankle. The other side of the body is pretty much unaffected. And you have a very, very obvious asymmetry, which shows up, to the naked eye as a limp, that you're able to track over a somewhat predictable amount of time. We know the general recovery period for procedures like this. So that's really our main focus. And then the market that, of course, is really sexy to us and really attractive is monitoring more of the neurological based issues. So stroke, Parkinson's, using this as kind of like a screening tool. That is really what we see down the road. But initially our first market will be that more predictable foot and ankle ortho.
Very cool. I love the idea of focus. Definitely there'll be plenty of opportunities, but finding the right focus is important. Next question from the chat. Who pays for this? What's the pricing revenue model?
Yeah, definitely. So we were super fortunate in the fact that Center of Medicaid and Medicare and Medicaid Services released the remote therapeutic monitoring codes. So those codes do in fact cover remote usage of this device, setup of this device, and then a provider scheduling telehealth appointments to discuss this data that's collected remotely. So ideally, this is something that's sold, the hardware itself is sold to a clinic pretty close to at cost, just based off the current reimbursement amount. And then really it's something that they get billed for from us every single month. So it's kind of more of a reoccurring software model, even though we have a physical sensor. So that's one side of it in the healthcare field. Who really knows what's going to happen with these reimbursement codes? That's the other thing that we have to be cautious of. So the other side of our business that's going to be a massive revenue generator, especially early on, is going to be sales to orthopedic device manufacturers. The person who really led this funding round is an orthopedic device manufacturer who's very interested in using this device to kind of track, do post-market surveillance really on how their implants are performing versus other implants. So kind of a competitive edge, and also a tool that could be used in clinical trials and research, as well as healthcare.
Got it. And who are people paying and using this today? Where is that in terms of use and people paying?
Yeah, so right now we're still in development. We actually just got the first proto boards. They should be built out by the end of this week with the person we're working with. So our goal is to launch the study with Houston Methodist, which is a validation study, early next year. We already have 3-4 clinics lined up that are ready to receive this. So right now it's kind of just the limiting factor is getting the hardware ready to be deployed.
Got it. Cool. And then another one here. Catherine's favorite question. What intros or help can the audience do for you?
Yeah, we're always looking to talk to PTs that would advocate this being in their clinic, as well as just orthopedic, really any orthopedic surgeon we're really interested in talking to, not just foot and ankle. And then really the market that we haven't gotten to talk much to, but we're really interested in talking to, are providers that work with people that are post-stroke, Parkinson's, are on more of the neurological gait side of things rather than musculoskeletal.
Got it. Very cool. Well, I know a PT if you need to talk to one.
Yeah, we definitely want to talk.
Last question came in as well here. What drove you to get into this? Is there a story behind why you decided to go after this opportunity?
There's really not a big story. It's kind of something that came up when I was working an internship at Micron. Realized that I absolutely hated it. I'm a computer engineer. And so my best friend, Cassie, this was all at Georgia Tech, was doing some research at Emory, or helping out with research at Emory, where they were looking at, Cassie, what was it?
It was stroke rehab.
Stroke rehab. And we had started talking about gait. And my background in computer engineering, the reason I am a computer engineer is because I love wearable devices. I've always been interested in building a wearable device. And so the two, kind of meshed together, and we ended up doing this as an undergraduate capstone project like 2 years ago. And it ended up becoming our full-time jobs post-grad. So that's kind of the story there.
Awesome. Well, thanks so much for sharing what you're working on with the group. And thanks, Christian and Mo, as well. JC, I don't know if you want to come back. We'll wrap up here.
Absolutely. Let me share my screen here. Maybe you can talk a little bit about some of the resources we have.
Yeah, so hopefully everybody got a chance to connect in the small groups. I saw a lot of activity in the chat, people putting what they're working on and how to connect. So definitely feel free to reach out. On our website, if you go to atlantaventures.com/healthcare, we record all of these meetups. You can watch any of the past ones from the last 4 years. If anybody's interested there, we highlight companies they're building here in Atlanta. So feel free to fill that out on the website, and we'll add your company and logo to the list if there's anything we can do to help there. And then, you know, upcoming events we probably do these every 6 to 8 weeks. This will be our last one for the year with the holidays coming up, but we've got an Atlanta Startup Combos meetup on December 7th in the morning. A couple early stage entrepreneurs beyond healthcare presenting. Another great way to connect. And then our next Healthcare Entrepreneur Meetup will be January 11th. We have John Marisha from Welcome Home Software that helps senior living facilities, CRM, sales and marketing. He'll be presenting sort of his story from Bain consulting partner to startup founder to starting to scale up. So it should be a good one there.
Yeah. Thank you, AT. I feel like there was one question in the chat also, if someone wanted to connect with people, again, take time and go now and connect, but also if you guys need those connections, you can email us and we will or tweet us or LinkedIn us, or we'll get you that direct email if you send us your email for those connections. So happy to share that out. And also, of course, we will share this recap out tomorrow so you can watch it again and re-listen to every single perfect presentation that we had today. It was really good to hear everyone's lot of variety, even in healthcare.
All right. Well, with that, we'll end here, you know, a minute or two early, but thanks again for all our presenters. Thanks, JC, for keeping us moving, and hope everybody enjoys upcoming Thanksgiving and the holiday season. And we'll see you in 2023.
Thanks, y'all.
Thank you.
All right. Take care.